How can we improve compliance and immunization requirements? Information about coronavirus, COVID-19, dominate today's news. Of those stories on when a coronavirus vaccine will believe be ready. Spiny 2020. I support our current concern with disease prevention and cure. When I was adopted and brought to the U.S. at the age of 2, I had to submit to a series of vaccines to meet the standard of my new home, and I'm very glad my parents followed that policy. My purpose in speaking to you today is to persuade you that vaccines such as MMR, chickenpox, meningitis, polio, and others related to debilitating or fatal diseases should be required by federal government to live in the United States and attend a public school, regardless of age, race, gender, religion, etc. I will present arguments supported with evidence in support of those purpose that includes these points. It is important that we as a nation protect the health of our children. A policy of mandatory vaccination can meet that need. Each child who receives a series of required vaccinations not only receives personal health benefits, but protects all children whom they come in contact. This can be accomplished by improving compliance with immunization requirements and by establishing a national policy which would require U.S. citizens to vaccinate their children prior to admission to any educational, institutional, and as well as examining the exclusion criteria of current policies. Immunizations save lives and protects others whom you come in contact, and the U.S. has a moral obligation to protect its citizens. A study by Paddock et al. 2016 revealed that between 2007 in 2014, there were 128,044 cases of preventable diseases that led to 1,336 preventable deaths. This is a tragic statement about preventable loss of lives and how of these lives were children who had no choice, had no voice nor choice. Although controversial Supreme Court rulings have established that U.S. institutions have no legal obligation to protect citizens, these cases have not been ruled unanimously. And distancing Supreme Court justices have disagreed with that position. However, state governments have established policies to enforce immunizations. Vitola 2016. This implies that as citizens, we believe in moral obligation to protect and serve. A policy of mandatory vaccination will motivate parents to meet the immunization requirements. Yes, we do have federal guidelines, state-level requirements for childhood vaccinations. Ventola's 2016 states that vaccination is compulsory for school-aged children in the U.S. However, public health officials are increasingly fearful of the option for parents to claim exemptions for vaccination requirements. Some reasons that parents hesitate or refuse. Ventola 2016. Medical reasons are allowed in all states. Religious reasons are allowed in 48 states, and physiological reasons are allowed in 20 states. These exemptions allow parents to refuse on the basis of concerns about side effects such as ADHD or weakening of their child's immune system, or causing other illnesses. These concerns are unfounded, and the CDC hotline attempts to put these concerns to rest. Fear of autism, although there is no evidence to support this fear, concerns about a large number of required vaccines or combination vaccines. Again, there is no evidence to support this concern. How can we improve compliance with current requirements? Strengthen healthcare provider innovators. Ventola 2016. We need to ensure that all healthcare providers strongly recommend vaccines and set up reminder services, which has been shown to improve compliance. Establish outreach in home services when necessary and information dissemination for all parents. But even more important is a change to the current situation. A clear national policy that establishes mandatory immunizations will provide protected needed. Now that we are learning several responses to the coronavirus, perhaps our new practices can assist us in this change. We can establish social distancing or isolation, which have been succeeded in part in preventing the spread. Maybe this practice can be integrated into current mandates for parents who refuse. Their students can be served with distance learning, which most school districts have moved to, and which improve with time. We can establish stronger consequences for parents who refuse to immunize their children and restricting current exemptions. Imagine our evening news and online news feeds with fewer stories of tragic and preventable deaths for disease and more stories about how diseases-free we have become over the generations. Our nation's response to the coronavirus has shown that we are indeed capable of relying to support new policies in these uncertain times. So yes, we have moral obligation to each other to protect the weak and vulnerable in this country. I have shown by strengthening our current immunization program and improving it with routines and behaviors learned from the coronavirus, we can improve compliance. As an adopted child brought to the U.S. from the Ukraine, I appreciate the steps of our country has taken to fight diseases. We are now learning every day that epidemics and pandemics can kill, and that we must take this seriously and take necessary steps into stepping up. Thank you.